We have some great guests who'll be spending the next hour with us today on Good Afternoon Arkansas.
Yeah, excited to have a great group with us today. Dr. Lisa Green is here. And Dr. Green, you're talking about difficult conversations that every family needs to have, how to initiate those conversations. What are some of those conversations?
There's lots of different conversations that can be had, whether it's conversations in a hospital setting or if it's conversations, it's the holidays with family members as they come around. So just dealing with all different types of difficult conversations.
Okay, yeah, that'll be definitely a good issue to tackle today.
Yeah, because a lot of us really avoid those
Absolutely.
At all costs.
Yeah.
Live from the KATV River Market Studio in downtown Little Rock, this is Channel 7 Good Afternoon Arkansas with Alicia Dover and Barry Brandt.
Dr. Lisa Green back with us now to talk about difficult conversations we don't necessarily want to have, but we need to have. Doctor, so good to see you.
Hi, nice to see you as well.
This is kind of coming into that time of the year when families are thrown together, or there might be some situations that warrant some difficult conversations. What are some of those issues that people tend to avoid having that conversation?
Well, we oftentimes, there's a lot of people who do not handle conflict very well. And so having family members coming into your home or going over to families' homes, a lot of people do avoid those confrontations. But it's important to, whenever you do have something that you need to discuss, to really decide if that is something that needs to be discussed when you're going into the home before you go in, and really think about what is the problem that you want to talk about.
Yeah, do you need to address it there? Can you put it off, I guess, or some of the things that might go through your mind?
Absolutely, because if you are doing it in the home, you don't want to do it in a public place where everybody's around. You want to do it somewhere where you're in private. Having those conversations is difficult already,
right.
But also you want to make sure that you're managing your anger before you go in and have that conversation.
So right when it happens is probably not the best time to then.
No, it's not. You need to take a break and really check yourself and make sure that your anger is in check before going and having that conversation, because once you do have that conversation, sometimes whenever people get angry, they get really defensive, and so you want to check yourself before having those conversations.
Sometimes though, there's got to be something on your heart or some elephant in the room, that you need to really address this situation. Putting it off can probably be dangerous.
Absolutely.
Right?
If you are the type of person who avoids confrontation, oftentimes we realize later that by avoiding it, it makes the problem bigger. And so by not addressing those conversations, it's important to address them when they come up rather than putting them off and then having a larger problem to deal with later on.
What are some other kind of initiators for having those conversations or things we need to think about?
Well, you want to make sure that you're in private whenever you have that conversation.
Right.
You want to make sure that you've checked yourself and that you are going and having a neutral conversation with that person, not assigning blame whenever going in and having that conversation. You want to make sure that you are using facts and not all emotion.
Right.
So those are really important in having those conversations.
Kind of a relationship type of thing. Don't bring up past arguments. Don't bring up other issues. Let's stick to this issue, I would think, too.
Yes, exactly.
Yeah.
Yes.
All right. Well, these are things that I know are difficult, though, for a lot of people. And sometimes I guess they just keep putting them off really long term.
Absolutely. And like we talked about, it makes the problem larger. And so it's really important to nip it in the bud and deal with the short term conversation rather than having that large problem later on.
All right. Well, those are inevitably, there will be those times when you're looking forward to seeing family and maybe dreading seeing family, and there will be those issues. So those are great starting points right there, I think, for what is sometimes inevitable. You can reach Dr. Green by calling the number on your screen. You can also email her at lisgre@msn.com, and there's all her information. She's from Baptist Health Behavioral Services. Thanks so much for being here.